risk pregnancies.
So I was kind of concerned because I didn't know if that was like a jab, like were you guys trying to have another child, or were you
No,
asking me if I was planning to?
no, none of the above.
Because I was trying to figure out, okay, so why is he bringing this topic up to me? Because as far as I know, we're finished.
Right. We were done 9.5 years ago. So with pregnancies and being pregnant is an exciting time for women and couples, but for approximately over 350,000 women each year, it's also a very stressful and risky time. High risk is a result of many factors ranging from age of the mother to high blood pressure. I thought it's only best that we have our resident doctor, Dr. Michele Reed, discuss high-risk pregnancies and kind of speak to the stress that women may feel when deemed a high-risk pregnancy.
Okay. So pregnancy is considered high risk if there can be any type of increased incident that can cause death to either the fetus or the baby or the mom. So if there's any type of chances of them having an increased health problem, that's deemed a high risk pregnancy. Well, some of the categories we sort of break it into is whether or not you have an existing health condition, depending on what the age of the mother, lifestyle factors, and conditions of pregnancy. One of the key things that I like to stress to my patients is, are you doing everything that you can right now so that if you do get pregnant and when you do get pregnant, you're going to have a healthy pregnancy? Couple of things. So if you have an existing condition of being high blood pressure,
Okay.
are you taking your medicine like you're supposed to? Are you exercising? Are you watching what you're eating? Because if you have high blood pressure, you're increasing the risk during the pregnancy that your pressure might go uncontrolled. And of course, when you do get pregnant, you're going to have to be switched to a different medicine that will not affect the baby. And babies that are born when mothers have high blood pressure, there can be damage to the baby because the baby might be born with a low birth weight.
Okay.
And one of the things that can happen to the mom is it can have kidney disease or kidney damage. Diabetes is another condition that we see a lot, especially in my office. But if we can work on making sure your diabetes is under good control before you get pregnant, we're going to be less likely to have any type of problems at all. Because sometimes the babies can be born with birth defects. And these are things that we can sort of prevent if we're doing what we're supposed to do. And I know I keep saying doing what we're supposed to do because it's something that's very easy for us to manage so that we prevent the long-term effects that could happen either to the mother or to the baby. With that being said, a lot of times when women get pregnant, they feel that they can just eat everything and that they're eating for two. Yes, you're eating for two, but at the same time, it has to be healthy eating for two because we've had patients who weren't diabetics or who did not have high blood pressure, but they feel every time they see ice cream and they start craving ice cream or they start craving sweet pickles or they feel that they want to have some steak or fried chicken, and that's going to increase the likelihood of you developing diabetes or high blood pressure, or even your cholesterol will increase. I remember one of the key factors, of course, of being a high-risk pregnancy is due to your age. And growing up, the age used to be 40.
Okay.
Now it's 35. So for me, when I became pregnant, I was 35 years old. So boom, I was automatically considered high risk.
Okay.
Then throw on the top that I was pregnant with two, because anytime you have multiple pregnancy, you're considered high risk. So because of those two things, I had to visit the high risk doctor. But at the same time, you know what? I'm pregnant. I can do as I please sometimes, but I had really bad reflux. What worked for me was ice cream. Cold Stone became my good friend. And Cold Stone became such a great friend of mine that Cold Stone decided that my cholesterol needed to go up. And these are things that, especially as a mom who went through it, yes, we have certain things that we like to eat, but everything has to be in moderation. And so no matter what we ask for, every time we ask for it, doesn't necessarily mean that our spouse needs to give it to us.
Gotcha.
But luckily I did not become a diabetic, so that was good. But other things that sort of are out of our control is if you have any type of autoimmune disease like lupus, say for instance, that increases the likelihood of you having or giving birth to an early baby or the baby being stillborn. And even with thyroid disease, if your thyroid is not under good control, the mom could have heart failure and the baby could be born with birth defects. So I guess just listening to certain things, I mean, these are things that we can prevent, except for if you have an autoimmune disease or if you have a thyroid disorder. And obesity. Yes, the average that they say to gain is 25 pounds, but it's also recommended that if you are not at a healthy weight to begin with, if you weigh more than what you should be, your weight gain should not be 25 pounds during the pregnancy. When we talk about age, another factor that we have to take in consideration, especially these days, is that we have young teenagers that are getting pregnant. And sometimes when they're pregnant, they don't necessarily go for their prenatal care because they don't want anyone to know that they're pregnant, and that they're able to sort of hide their pregnancy, because we've had cases where they've been pregnant for the full pregnancy and no one knows until they present with maybe back pain or they're in labor. And then that's when people find out. So a teen pregnancy is an increased risk for being high risk. And that's something that we need to make sure that we talk to our teens, because sometimes they continue to have sex and sometimes they have unprotected sex, which increases the likelihood of them giving birth while they've been untreated for gonorrhea, chlamydia, herpes, and even sometimes HIV.
Doc, thank you. Oh,
I was going to say two other things that we can also prevent. Is if you smoke, especially cigarettes. And of course, nowadays we're getting a lot of people smoking marijuana.
Right.
If you're smoking cigarettes, marijuana, or drinking any alcohol, the best thing is to just stop it now. Especially with the cigarette smoking, we're seeing babies that are suffering and developing asthma and allergies after they've been born, or sudden infant death syndrome, being exposed to the cigarette smoke. So a lot of things to think about, because when you go and you decide you want to become pregnant, you really have to be in the best physical condition that you can be in, because it's going to be a lot of stress on your body, physically, mentally, and spiritually.
Gotcha. Well, I appreciate you giving us the words of wisdom. And I mean, when I saw the topic, there was only one person I wanted to speak with, and that was you.
Okay, but like I said, I just wanted to make sure that you weren't trying to insinuate something was going on, that I needed to get pregnant, or that you and your wife were thinking about having another child.
No. We're done. And I think Rich and his wife are done too.
I don't know. They're not here today, so we can't say.
But no, I saw this subject matter, and then, like I said, there's only one person. I mean, I see a lot of different subject matter. But some of the stuff I present, and some of the stuff I've presented before in the past, and you were like, no, I really don't feel like talking about something like that. And I'm like, okay, I back away. I usually do. But you're great.
But that's all right. But thank you very much.
Nah, always. What was the topic that I was thinking about in a couple of weeks? I didn't want to send it to you, too many different items. The item was, hang on. I saw it and I was thinking about you, and I said, if I send this to Doc now.
Was it how to prepare and run your first half marathon?
No.
That you were going to do?
It was on probiotics.
Oh, probiotics? Okay,
yeah.
That's no problem.
Yeah, it was about that. No. Running my first marathon.
No, half marathon. Because, you got this 5K coming up on April 9th.
I got the 5K coming up, and I'm really excited about that. And no, I'm getting prepared. I'm prepared for that. Don't even worry about that.
Okay.